We just got an email from Vice Chair Golly-Rand. He is double booked in another meeting. He's going to try to join us as soon as he can, Chair.
Okay, thank you.
Commissioner Clarkson.
Here.
Pat Garrett also just sent an email. He's got an emergency that he's dealing with. So the sheriff will join us if he can. Chair Vesna.
Present.
Member Emeritus Biglin.
Present.
Representative Solman.
Nicole Vargas is here from her office.
Thank you, Nicole. Glad you're here. Judge Block. Oh, he's coming in right now. Good to see you, Judge. Was just calling your name and you came in. Glad to have you.
I'm here.
Director Steve Allen.
Hi, Nicole.
Okay, Nicole, you're representing Steve today? Thank you, Nicole. For the first time in my tenure, we do not have a quorum.
Woo!
All right, we're not conducting business that requires a vote. Chair, I'd recommend that we go on and wait for the rest of the commissioners to join us, and we'll just move on.
Yeah, sure. I know everybody's really busy. For the people who are here, thank you. I know other people are pulled away at work. Assuming some of that has to do with Measure 110. Everybody's scrambling and around in circles trying to figure out what's going on. You know, and appreciate the Oversight and Accountability Council members who are trying to figure it out quickly with all the pressure that's on them to get all the money out the door. So, and there's just a lot of work going on, ongoing pandemic stuff and trying to catch up. I think that we have a really great meeting today. I'm actually really excited about it. I think some of the pieces that the ADPC needs to be effective are starting to come together, and we're going to hear a little bit about that. We do have a special guest with us that I believe Paige brought in out of initial conversation me and her had, and then Dr. Richardson got looped in. And so I'm going to let Paige and Dr. Richardson kind of tee us up for our first informational agenda item.
Great, thanks, Tony. Dr. Richardson, do you want to say anything, or you want me to just dive right in with?
I'll just say that we've heard from a number of sectors across the state. This will be the first time that we'll hear from a local school district. Salem-Keizer School District is the second largest school district in the state, and every school district in the state is required to have a drug and alcohol plan. Salem-Keizer actually has one. They've got are working on related issues, and I'm really excited to have our superintendent join us today to talk about what they're doing. And now, District Attorney, feel free to go ahead. Thank you.
Sure, that's awesome, and that's exactly right, Dr. Richardson. So this actually did come out. I wish I could take credit for any of this. I can't. I'm the middle person. Tony actually called me, what, maybe even 6 months ago or so now, and said, hey, how can we help kids? How can the commission get involved with schools and kids, and what's the need? And I was like, you called the district attorney, and I don't know how to answer that question, but I know who to talk to. And one of the privileges of being in my role, frankly, is that I get to be in a lot of spaces where I get to hear really smart people talk about their specialty areas and what they do know and what they are doing to fix things and find solutions. And so I'm really good at calling those people on the phone. That is one of my biggest skill sets. So when Tony asked, like, how can we get involved? I said, well, I know who to ask. I don't know the answer to any of those questions, but I know who to ask, and immediately called Christy Perry. Christy Perry is the superintendent of the second largest school district in this state, Salem-Keizer. She's also, I think, our reigning superintendent of the year. Is that true? Like, I don't think she has not been, she's not been dethroned yet. I think there'll be another one, but she is the current superintendent of the year, and that's a title that doesn't come easily in the state of Oregon. And so I know Christy to be just an expert in all things related to kids and their welfare and their and the positive, healthy education for them. And I knew that there was already work being done in this area, and that Christy could do two things. One, tell us what is being done, and two, tell us what we can do. And as a commissioner, that was actually really exciting to me, because I know we're all kind of yearning for something to do proactive rather than just taking in information. Tony and I had this conversation. What can we actually do? And there's so many opportunities out there, but everyone can get behind kids and what we need to do for kids and families. And Christy has some really great ideas, not just in prevention, right, but also in actual services, actual treatment. And so it really runs the gamut of all ages. And we thought Salem-Keizer Schools would be a great place to start. I also want to add that also on the call today with us is the other smart person that I knew to call, which is our juvenile director, Troy Gregg. Troy is on the phone as well. I've sucked him into this process also because our juvenile department intersects with a lot of these families and a lot of these kids and works really closely with Christy and her folks. So it didn't make any sense to be in one place and not be in both. So I was lucky enough to get all of us on a phone call and start this process. And Christy agreed to bring her real smart people to talk about all of that to you today. So that's all I've got. That is the extent of my knowledge base. And I'm going to turn it over to Christy. Thanks for being here.
All right, thank you. Thanks for picking up the phone and calling me. And I'm assuming you're going to want me to share screen on the PowerPoint slides. Is that all good to go? I know how to do it. Oops, you're muted.
Yeah,
I
because
think
I never used this system before. I actually am going to run it for you. All you have to do is tell me to advance the slides.
Awesome, that's even better. Perfect. So I have two people on with me today. Dr. Suzanne West, who is our Director of Strategic Initiatives, and then Gwyneth Bruey-Fink, we call her Gwen, who's our Director of Secondary Education. And I thought that you might have a depth of questions that I needed a few other people with me to present on. So that's why I went ahead and brought them with me. I don't know that we have landed on the exact intersection or the exact project or what we'd hope to see, but I thought I'd start with some kind of knowledge about our schools, what we're required to do, what we're seeing in our trends. And I think what I would start by saying is we are seeing an escalation of youth concerns, whether they're drug and alcohol, physical assaults across all of our schools, but I also know across all of the schools in the state and probably in the nation as a result of the pandemic. And I don't know that my stats today around drug and alcohol use will really get the whole picture. Because as we're out of school in the pandemic and in hybrid, I don't know that we've fully realized the effects of that. And we do know that kids self-medicate with drugs and alcohol in really hard times. So I think I have enough trends to show you where the entry points are, and that's my goal. And I think we can make some assumptions from that. So go ahead and advance to the next slide. I just think it's really important for you to know who we are first, because interacting with schools, we're a fairly large and complex systems. So I thought I'd tell you who we are. So first of all, we really do have a vision around prepared for a successful life, and that includes understanding how to stay safe and healthy. And so the purpose is to provide you that information and how we show up to that work and what our part is in that work. And my biggest dream of the world that I hope I accomplish before I retire is to really have a system that connects community, school, nonprofits, health healthcare providers, prevention coordinator, and agencies all together in one system that's working in the same direction on behalf of kids. We do it in lots of places, and we do it very well in some places, but I think, and this is greater than me, right? But I don't think the entire system in Oregon really aligns with putting all our resources in the right places for kids, which we know is the prevention place. So that's what I'm gonna that's on my heart, I guess I would say that. So Salem Kaiser has about 40,000 kids, and we have about 12,000, over 13,000 high school kids. We have almost 10,000 middle school kids, and then about 15 to 17,000 elementary students. We have 65 schools, 6 comprehensive high schools, an alternative school, a career technical education center. So we're spread out in the community, wide and far. Also in our community, though, a thing that impacts us is we are the county seat. We are the state capital. We have a number of prisons that surround us, and we have housing that is more affordable than the Portland metro area. So when you compare us to a Portland public, we have a much higher poverty. We have the largest number of students learning English. We have the most migrant students because we're surrounded by this rich agricultural area, and just a lot of student needs that come with that. What also comes with drug and alcohol use. So go ahead and go on to the next slide. So just to orient you a little bit, we do have a state law, State Administrative Rule 581222045 about prevention, education, and drugs and alcohol. And we are required to have a comprehensive education plan of instruction. It's aligned to state standards. We have drug and alcohol free policies, and we also are required to have consequences for kids when they bring drugs and alcohol on campus. And we also know that consequences and discipline doesn't stop addiction or alcohol and drug use. So we are continually balancing prevention, diversion, more education, more parent engagement, services with our students as we navigate them. Go ahead and go on to the next slide. In grades K through 8, 9, and 11, we talk a lot about healthy living, making healthy choices and decisions, and it's really a lot of times integrated in our health curriculum. Our health curriculum gets a lot of attention for our sexual education, a comprehensive sexual education gets lots of attention for that, but a really bigger part of our curriculum for health is around prevention and healthy behaviors, and that spans multiple areas. So as kids get older in our system, we give them specific knowledge and skills related to alcohol and drug prevention and decision making, and to know the key concepts of what it does to short-term impacts on health and decision making, and long-term impacts on health and decision making, and trying to teach kids how to say no when they're among peers who are saying yes. And that's a really hard thing, is the more drugs and alcohol are normalized in our society, in our community, the more that's normalized with our kids and their peers. So we are really trying to help them with refusal skills, decision-making processes, and then helping them with understanding how to have healthy activities, healthy options, and where to reach out for support. And you'll see that in some of our data. Go ahead and go on to the next slide. We do have a number of kind of laws pertaining to student discipline. And so it's important to know those. Then it's also important to know how we interact with those. So there is state law 581210005 that students shall be liable to discipline, suspension, or expulsions for misconduct and unlawful use of drugs, narcotics, or alcoholic beverages on campus is misconduct in our minds. But we try to start with the value that restorative practice and educational practices related to drug and alcohol abuse. We don't allow it on campus, but we also know that a suspension, an out-of-school suspension, can lead to more drug and alcohol use. So we try to really use diversion as a first step. When I first started here, the first step in diversion, a student showed up under the influence on campus. The first step was a suspension. And we intervened in our discipline system to say, no, the first step for somebody that comes onto our campus under the effects of drug or alcohol has to be diversion. And of course, kids bring drugs on campus and sell them. Very different scenario than kids coming back from lunch having had a few beers at lunchtime. So we have a kind of referral process for diversion that either comes at it from two ways. One is a student incident, a student discipline incident, where a student comes on campus under the influence of drugs or alcohol. A person on campus notices and says, let's send this student through diversion. The other way is kids tell adults. Our goal is to have lots of adults in the system where kids will tell things too. So a kid tells somebody I've been drinking, even though they don't come on campus, we can also push them into a referral or diversion, not discipline referral, but a diversion system. So we have two diversion systems. Go ahead and go on to the next slides. And honestly, as you know, there aren't enough drug and alcohol treatment providers for adults, let alone for kids. And so that's a really important place for us. We actually, we can have a philosophical discussion all day long about what a state school fund should pay for and what our community should pay for in other ways. Diversion of programs for drug and alcohol use, I think our community should have more that we can access for kids, but we choose to pay for it because we know that if kids don't get the help they need, they can't exercise education and interact in our education system. So we pay for diversion programs for our kids because it's so important to us that they can get the help that they need so they can access their education. Students under the influence or addicted to drugs and alcohol can't access academics. So that's how we think about it. So we have two programs. One is called Third Millennium. It is an online program, self-paced curriculum about drugs and alcohol, tobacco use. And we know that people change lives. And so you say, why do you put them on an online program? Well, we also know that our kids show up today very adept at being in online environments. So we have Third Millennium because it's a way for us to get to kids on some first offense type. I'm in the modulars by McKay High School, and you know, some kids drive with really loud cars. So if you hear that in the background, student outside here probably doesn't have their muffler on their car today. We use that as an intervention, and students access it during either a disciplinary process or a referral. And then we have a trusted adult that helps monitor that with them. And then the second really great partner for us is Bridgeway Recovery Services. So it does give small group counseling. It's used as an intervention. The hook for us with kids is to say, hey, we want you in school, so you go to diversion instead of a suspension. And that really helps us hook kids and families who want their kids to remain in school. So we do access Bridgeway Recovery so that kids can get the true help they need in a therapeutic setting in hopefully a time in their life when they can get it ahead of a true addiction that will really affect them into adulthood. So that's kind of how we approach prevention, diversion, intervention as a whole big system. But then let me just show you what our data tells us about our kids so you can help understand where where prevention starts and diversion and intervention goes next. So next slide. So we did participate in the Healthy Teens data survey last year. And I'll tell you, it wasn't a great end size because a lot of kids are like, oh, I'm so done with computers. Please don't make me take another survey. But I think we have enough to tell us a trend. And here's the thing, that when you look at 11th grade, around the alcohol use, 41% of our 11th graders have used drugs and alcohol. And there's also quite a bit of binge drinking that occurs at that 11th grade year. If you back it up to 8th grade, you see that is about 18%. So you can see the huge escalation from 8th grade to 11th grade. Back it up further, 6th grade. Even at 6th grade, we have almost 10% of our kids that have at least tried drugs or alcohol. We're seeing a big uptick in vaping, electronic cigarettes, and that is showing in our data as well. Even last year, we know that we had a few kids in elementary school that are already starting with some alcohol use, which is frightening for sure. Thinking that, you know, a 5th grader might have already had their first at least drink of alcohol. So even though the N size was small, I think this is a trend that you could see statewide in the data around drug and alcohol use. And see, if you look at those 11th graders, that asterisk at the bottom, 37% indicated binge drinking within the last 30 days. Okay, next slide. I think I talked a little bit about this already, the difference between diversion and discipline. And we really do believe in the diversion tactic. And we know that because kids are in our care and it's a place kids have to come, that we have an immense responsibility to intervene because they show up in our schools every day and we know who they are. And I think that's why schools are such a great partner interface and a connector to figure out how do you have programs that support kids. We also really know that intervention has to start with the families, and Dr. Richardson and I have lots of conversations about how can we become better as partners, not just in the commission's work, but in some of his other work in our community, so that the community can help with family intervention, because we know if we can intervene with families, kids will be better. And so we have lots of conversations about that because we know that the family problems are end up being kid problems, which end up showing up in our schools. And so we know who those are, and we have indicators of where families are. You think about students who might chronically show up late to school. Now, this is not a generalized statement, but enough digging in might tell you that parents are sleeping in well past the start of school time, and a little more digging with the student might indicate drug or alcohol use on a regular basis the night before. So you can't say every kid who's tardy has parents that are under the influence at night, but you also have to watch for tardy trends and ask enough questions to figure out what's going on in the families. And I'll tell you, our schools, our administrators, our teachers, and our counselors know that information, and often we're felt like we don't have enough to help intervene on behalf of our kids and our families. All right, so next slide. For the 2019-20 school year, we did have 625 incidences of possession or distribution on our campuses. And keep in mind, we have 40,000 kids, so that number seems really huge. It's a big number for sure, but if it were 625 in Cascade School District, that would be a way different percentage than 625 in Salem-Keizer with about 40,000 kids. So out of that 625 incidents, it represents about 485 kids. So 485 kids had incidences. Some of them had multiple incidences to get to the 625. In 2020 2021 school year, 164 incidences. And here's the danger in that data. We can look at it two ways. And I think I heard somebody tell me that the Department of Human Services is talking about the decline in reports and foster care placements during last year. And so I want to talk about this as this isn't the 164 incidences is not the number of kids that are, there's no reduction here. My best crystal ball tells me there's actually an escalation, and there was very likely an escalation of drugs and alcohol use in the homes and with kids because they weren't in school as much. What that data tells us is they didn't come to school using drugs and alcohol. And let's remember in 2021, about half of the year, we are completely in comprehensive distance learning. And when kids are on the screen, you can't tell as much about drug and alcohol use. You don't know as much about child abuse. You don't know about a lot of things that are happening with kids. So also in 1920, we had 4 students that had incidences at the elementary level. So enough, something happened that they either brought something to school or and I will tell you, we do have kids that end up with now and then with a bottle of alcohol in their backpack from their parents who might not have ever tasted it. It just felt like a really cool thing to bring to show and tell. So sad, but true that happens for our kids. And that's really a first step in a student using at times, just that lack of awareness that that's not a thing that a kid should have. So we did have 6 elementary incidences in 1920, and I think hopefully we can keep under 10 at the elementary level. But if you want a true major intervention place, 6 kids, we can figure out something to do with their kids and families if we have elementary kids with incidents. As you go up to 6th grade, again, there's more. But again, if we could as a system get it at that moment in time and figure out how do we help the student and the family as a 6th grader, fewer kids, and it also helps before the behavior is so escalated, it becomes an addiction. So the next slide is our referral and our documented diversions. So in the 1920 school year, we had 114 high school referrals to Bridgeway and 50 middle school referrals. And we feel like that's our most important data point because that's when we were in school most of the year. So it gives us a really true look at what is the need. So we reached out to Bridgeway to get those numbers. All right, so that's the end of the slides. And let me just tell you my thoughts on some really good entry points. One is we can really use help for our educators on how to teach drug and alcohol prevention. For our health educators, our educators are pretty good, but the research changes so quickly. The types of drugs and alcohol, methamphetamine uses up, and all of that changes so quickly. Helping us be on the front end of what our kids are facing and seeing is really important. Another place that we can really use help that I think is an important entry point is around families. We can get a student into a diversion program, but if the family doesn't get the support they need, it doesn't matter how much we do with diversion. We're hoping it will help. And that's a hard place for a school system to show up in parents' homes and help them with the things that happen in homes. We're really good at education. That's kind of where we can't cross the line very well, even though we try really hard to support parents. A true interventions in homes just isn't our what we can do or probably should do. We don't have the expertise for that. We've also talked a little bit about a great place would be to think of to take a school like a middle school and look at that the neighborhood area and really decide how do we have an evidence-based prevention strategy in a neighborhood. what we're seeing in schools with drug and alcohol use, with fights and assaults, with some weapons brought into schools, aren't school issues. They are things that are happening in the neighborhoods that are escalating on the way to school, that are walking into our schoolhouse for the most part. Now we know we've got kids, going like this still, but the drugs and alcohol we don't serve them at lunchtime. So they're coming from homes, from neighborhoods. And so that whole concept of a healthy neighborhood, a healthy families, I think is the place where we have the biggest amount of work to do as communities in support of kids and families. So that's kind of where I see the entry points. And then I'm going to quickly ask Suzanne or Gwen, do you have anything you'd add? And then we'll open it up for questions and discussion.
One correction, which I just need to own myself. There was one error on the slide that I want to point out. The 164 is year to date for this calendar year. So that was my error because I actually prepared that slide. So I need to let Superintendent Perry off the hook there. But we don't really have good data for the 2021 school year because so much of that year was in comprehensive distance learning. We only had a couple of months during which we actually had in-person instruction with students. And that period of time when they were back was such just an acontextual in terms of what school typically looks like, that student behavior was not what it would normally look like during a school year.
Thank you.
And I don't have anything to add. Can you hear me okay?
Mm-hmm.
New microphone. I don't have anything else to add. I would just echo what Superintendent Perry just said about healthy neighborhoods and healthy families equaling healthy kids. We talk a lot in our system about our multi-tiered systems of support and how we can't create tier 3 or individualized interventions to solve a groundswell problem or a groundswell need at the tier 1 level. And so we can intervene with individual students, but when really the issue is in the neighborhood or in the home or in the community, it's, as Superintendent Perry so eloquently said, it's more of a hope than a real true intervention. And so anything that this team could do to help us wrap around supports around families and neighborhoods would make a huge difference.
All right, I'm happy to open it up for questions, and we can be here as long or as little as you need us. And I really appreciate being able to come here today.
Yeah,
Thank you, Superintendent and staff. Chair, there's a question from Kat.
Yeah, go ahead, Kat.
So, there we go. In terms of like your diversion versus discipline, I noticed on that slide that the discipline can include referral to law enforcement. And as a public defender, I'm super concerned about the school to prison pipeline. And so I'm wondering what it is that you're referring to law enforcement, and is that something that could actually be dealt with internally? So because once the kid gets involved with the juvenile department and then they're on probation and then they're more likely to be on adult probation, and escalate in the criminal thinking errors. So what is being sent, and could any of that be kept in-house?
So let me answer that, and I'm hopeful that since you have Troy on the line, he'll answer with me. So key in a school system is a very strong relationship with your juvenile justice system, because they have to work hand in hand in keeping kids out of the school to prison pipeline. So what might be referred to law enforcement, which then they would immediately refer to the juvenile department, is a distribution on campus, and distribution that might lead to harm of another kid. So we've had distribution on campus where then the kid's taken on campus. And so you've really had harm and potential life-threatening harm to another student. So that's why, and we have to put that in our code of conduct that way, because we also have to give due process notice to parents that there are certain things that will have to hand off to law enforcement. So we reserve that for those very extreme cases. A student showing up under the influence, not a law enforcement referral. Students bringing drugs on campus, not necessarily a law enforcement referral. Students distributing, selling, and other students being harmed, that's where it's handed off. Then the trick is that the juvenile department can help get the student and the family the services that we can't always get when it's not in the system. So Paige or Troy, I don't know if you could answer that, the second part of the system.
Yeah, I would love for Troy to answer that. And the only thing I would add, and I'm hoping Troy will address a little bit, is Measure 110, as you all know, did not exclude juveniles from the decriminalization, right? So juveniles can have small amounts of drugs without it being a criminal offense. And in Marion County, we recognized that really early on before the measure took effect. And we had really intentional meetings that I think Troy will talk about, because we were really concerned about losing connectivity to those kids, which then allows us connectivity to those families. And a lot of those families, Troy and his folks at the juvenile department are highly involved in. So I'm sure Troy will address exactly kind of what we did, because we didn't want to lose track of them. Even if we all agree that the criminal justice system isn't the best place, it certainly was a touch point for treatment and wraparound services for those families. So Troy recognized that early on, and our law enforcement community, including my office and our major police agencies, came together to try to address that at this level. So Troy can talk about that a little bit.
Thanks, Paige. Hey, everybody. So I appreciate the conversation very much. One, on the PCS, DCS, we don't see a whole lot of those anyway. Those numbers are super small as they come our way. And as Paige was mentioning, the ballot measure 110 and the decriminalization really has impacted. And I just checked with my staff to see even the number. And what we created was, we still wanted those potential touch points with kids just to make sure that they were being referred to the services that they need and that were available to them. And so we've only had 5 is what she could think of off the top of her head that have even had the referral. And unfortunately, at this point in time for us, that referral, as they come in and just check in real quick with a PO, is giving them the online number to connect in and tag for services. And that's our biggest concern. I hear the school to prison pipeline and everything like that. We have the goal as the juvenile department is we don't want a kid to take one step further than ultimately that connection with us. But what we end up doing a lot of times, and Christy was mentioning that too, is that we end up being able to tap into resources that the school district isn't necessarily able to do. And we know that historically drug use can lead to more serious crimes when it comes to kids. And if we can't do that intervention, which has been real challenging for us now, because we're not getting those referrals a lot of times to make that initial connections with kids, especially around drug and alcohol use. The concern is that ultimately you get them committing crimes that are related to their use. And so our goal, and like I said, our pure goal, and looking forward to working even more with the school district on that, is to figure out how do we divert kids and keep them out of the system. That's a majority of the kids that come our way. That's what we do. We try to reach out and try to make connections, like I said, whether it's through Bridgeway, whether it's through services that we can offer or support. Those are things that are really priority for us. And like I said, I just have a really strong concern just kind of where we are right now, and just wanting to make sure that we can, it's hard because as a juvenile justice director, our role is to work with kids that get referred through the police department, and so the needs for the kids don't necessarily hit that level a lot of times, and there's still work and stuff that we can do with them to help out. And so I try to figure out the balance of how do I do a lot of even pre-work and intervention and support that we can for the community before they even get to us, because any work that we can do before they even touch the system as a whole ultimately just helps us to keep them from going deeper into the system along the line. Unfortunately, like I said, directly, that's not our role as the juvenile department, but it's a passion of mine to figure out how to get it done too. And we do have we do have one program in particular, the family support program, that's outside of adjudication for kids. And so that's something that we'll be connecting up with the school district about to make sure that we get there the referrals, and it may very well be able to impact at least some of the kids that you're talking about when it comes to families, because their work is directly with families and supporting families with kids that are struggling and have the potential kind of get deeper into the system. So that kind of touches it a little bit, I guess.
And just a comment on our system, not Salem Kaiser, but the system in Oregon and probably the system in many states. There's a miss. If we think about systems problems, there's a huge miss in the system where we know, and the juvenile justice system knows, and the only way to have an entry point is through law enforcement. If you think about, this is my, I want to change the world, not related just to drugs and alcohol, but what if our system had something in between that was really well defined as a place to hand to support before, because we can start identifying those kids as early as 5th grade. And to have that intervention at that point in time, I love the relationship we have with the juvenile department, because that's where his heart is. But what if we lived in a place that didn't have that strong value set with their juvenile department? So thank you, Troy.
Well, and I think it goes without saying, but I mean, that's kind of why this information is being brought to the commission today, right? Like, we're trying to figure out, is there a pilot program? And that's what Tony and I talked about 6 months ago. Is there something proactive we could do and leverage all of the smart people on this little Brady Bunch box thing we got going on here today? Can we leverage that and actually create that, really what Christy is describing, that middle ground? And if they can identify that in 5th grade or even younger, isn't there something we can do to bridge that gap all the way from education into prevention and into actual treatment and services? And I think what a cool thing for the commission to try to spearhead, and let's try it and see if it works. It's just, we got to get behind it and actually come up with a concrete plan to do it. But that's why I brought the smart people.
Yeah, no, thanks so much, Paige. And I think Tony Bigland, you've raised your hand, and Tony's has been spearheading prevention efforts for a long time. So Tony, do you want to chime in?
Well, what strikes me is that the number one thing that comes to my mind when you talk about something in the system that would work, it would be to increase the availability of family interventions. And we've got a subgroup that's working on what family interventions are out there, and there are a lot of them. But the systems by which you get from this family's got a problem to that, I think there's a lot left to be worked out. But that would be the number one thing to focus on, in my view, is families.
And if you, as I always think of a pilot project, I always think start small, create the system, and then build the system that's replicable to other areas. So if you said, okay, we're going to take a middle school in Salem Kaiser, Claggett Creek Middle School, and we're going to look at what are the elementary schools that feed into that system, and could we take 10 families, 15 families, that 5th graders going into 6th grade that we know are at risk, and if it's not 5th grade, it's 6th grade that we know are at risk at a school, and intervene at that moment in time. That feels like, given where our numbers are, that's kind of the place. And if we can do that in one feeder area, one middle school feeder area, that's replicable to every school district in the state, every feeder area in our system. So I think that's the place. It's super exciting to talk about, because we're all in reaction so much. It's super exciting to think about what could we really do to change the system instead of always reacting to the current crises in the system or the real crisis needs of kids.
Yeah, I think that's a very good idea, and there's substantial evidence that you could make a difference with a good family intervention.
So, Dr. Richardson, I want to throw something out there in the spirit of time, and then see if it would be okay to move forward. It sounds like, Christy, you came here looking for help. We want to be helpful. Tony, sounds like you're working on some of this stuff. There's this idea of a pilot program being thrown around. Is it okay for like Dr. Richardson to work offline about maybe something the commission could do, and then bring it back to the full commission to like vote on in the future or something? Explore some ideas to help you out.
I think we can, and we are. We are actually beginning our first meeting tomorrow to sort of begin to map out that information. We're going to have in person, and we can invite. We'll put up a link so that if any of the commissioners want to sit in on that meeting, they'll be available to do that. But we want to begin that process, and I think Tony, I'll talk to you offline. But if you could be a part of that, that'd be great. Our subcommittee that's working on prevention and working on family interventions, I think this potential fits right into their scope.
Right.
And I think we could continue to do that and get something solid and then present to the commission at one of our upcoming meetings. So we'll get started on that right away.
Well, I'm just excited that that seems like we're gonna do something, meaningful, and it seems like it's in the right place given all the funding that's going into, acute services, recovery support and stuff. Prevention's really been left out for a long time, and so it seems like a really good use of our, agency and utility in this system. So if nothing else, Christy and crew, thank you guys so much for coming along. And if it's okay with the rest of the commissioners, I'll go on to the next agenda item.
Awesome. Thank you.
Superintendent, you and your staff are welcome to stay, or we understand you got a lot going on, so whatever is best is good with us. So thank you.
Thank you. And I will see you tomorrow. So.
Okay. Bye-bye.
Okay. Thank you.
Okay, awesome. And thanks so much for coming again. Next up, we have our old friend who's still working with the commission, even though she's not on the commission, and that's Dr. Liz Waddell, to give us an update about the framework for completing the SUD inventory. So I will pass it off to you.
Thank you, Tony. So I want to introduce Katie Lenahan. She is research manager in my group at the OHSU PSU School of Public Health, and is the amazing project director for what we now call the inventory, substance use disorder prevention, treatment, and recovery in the state. We want to have as much time for questions as possible. So Katie, maybe you can just introduce yourself and we can dive right in. Excited to be here.
Sure, thanks Liz, and thanks to the whole commission for having us here today. My name is Katie Lenahan, and I am the project manager for Dr. Waddell's research group and directing this inventory project that I'm going to share with you all today. I have a short presentation, so I'll share my screen. I'm fairly new to Liz's team. I started with her in September of this year, but I've been at OHSU for 8 years now, previously directing a science outreach program that worked with students 6th grade through college to increase racial diversity within health and sciences. And I have my MPH with a focus in epidemiology, and really excited about the work that we're doing on this project and sharing more about it with you today. So we're calling this the Oregon Inventory of Substance Use Disorder Resources across the continuum of care. To share a little bit of background about the project, the OHSU PSU School of Public Health, in collaboration with ADPC, as well as staff from Oregon Health Authority, we're in the process of developing this inventory and gap analysis of the statewide resources available to address substance use disorder prevention, treatment, and recovery in Oregon for youth and for adults. So for the rest of this presentation, I'll be referring to it just as the inventory, but I really am referring to the inventory and gap analysis across the full continuum of care. When we refer to substances in this presentation, I'm including that as alcohol and other drugs, including cannabis, but excluding tobacco and nicotine. This inventory meets the objectives of the ADPC statewide strategic plan, and we see this as a critical first step towards documenting county level need for services and the associated gaps in the service delivery system. Before we go too much farther in the presentation, I want to address the fast timeline of this project, which will be going through June 30th, and our team's investment to complete this project with a high level of integrity. We know that things in our state and our world are rapidly changing. We'll be able to provide a snapshot of what the current landscape is in Oregon with the hopes that this work can continue so we can dig deeper and update the analyses as things continue to change over time. And then one other thing I want to call out is as I talk about our process today, I'm going to be mentioning our work happening at both the state and the county level. Our project team aims to be as inclusive of all the communities in Oregon as possible. And we want to specifically keep in mind the needs of the Oregon's 9 federally recognized tribes and Native American communities. However, we haven't had the time to appropriately connect with the right stakeholders to do this in a way that ensures inclusion is being done with the approval of tribal communities. So for today's presentation, I won't call out tribal communities specifically because it didn't feel like we had the appropriate level of information. We're still in a learning phase right now. So far, we've built a strong project team. This is comprised of OHSU PSU School of Public Health researchers, as well as data analysts from OHSU Center for Health Systems Effectiveness. This team includes people with extensive knowledge and experience in SUD research, working with youth and youth services, SUD services specifically in rural communities, and then strong statistical analyses, especially around Medicaid data. We also have student workers that we're going to be hiring, and they're going to have a boots on the ground approach as much as they can given the restrictions with COVID, but they'll be making phone calls, doing site visits to resources to understand in depth what services are available. And I'm going to talk about that in more detail later in the presentation. So we have 3 main objectives of the inventory project. The first objective is to estimate the number of people at risk of developing a substance use disorder. We know by quantifying this number, we can start to estimate where additional resources may be needed for prevention, treatment, and recovery services, especially among youth and other high-risk populations. The second objective for our project is to estimate the number of Oregonians with diagnosed SUDs, as well as the number of receiving treatment for an SUD. Again, this is another critical first step to meeting the need for statewide prevention, treatment, and recovery resources, and it's something that is currently not well understood. The number of Oregonians with current service need will be estimated at the state and county level. At the state level, as we're able to based on the data, we aim to also be able to estimate this by different age group, race, ethnicity classifications, and income as possible, and that will really allow us to see where there's some inequities or differences between service need and services available. And then our third objective is to create a catalog of all these SUD services across this full continuum of care. We see this catalog as something that can be a living and searchable document. It can serve as a resource for counties and statewide, and it also can be a way for us to identify gaps between the need for services and what's currently available. While there is a catalog like this for the treatment services available in Oregon, there's no current directory of statewide prevention, treatment, and recovery services currently available. So in order to meet these objectives, we have a couple of different methods that we're going to be used. And the first one is something called the CAST, which stands for Calculating an Adequate Systems Tool. Tori Algie previously presented about this tool to the committee, but we'll share about it again. The CAST was initially developed by researchers at SAMHSA. It is based on an extensive review of current research and literature that assesses social determinants of SUD risk in communities. And it's really meant to be done at a county level, which is great because that was the objective for us as well. It provides county level risk classifications, and the tool also makes estimates for the number of people with an SUD, the number of people who will be receiving treatment, and estimates for how many resources are needed in different specific categories. There is an example of this tool provided in the appendices of the project plan that we've submitted to the commission. We also are able to work directly with the tool's creator, Dr. Brandon Green. He's providing us with the most up-to-date version of the tool, as well as offering some support to help us tweak the tool so it can really fit what's happening in Oregon. The second way that we will be doing meeting these objectives is to use available survey data. There's several sources of self-reported data about substance use and diagnosed SUDs that's available at the national level, as well as state and sub-state levels. These are conducted regularly. The published data is available for additional analysis, and we have a list of the different kinds of survey data we will be utilizing in the appendices as well of our full plan. And then finally, we're going to be using Oregon Health Plan data. Part of our research team with the Center of Health Systems Effectiveness has been able to aggregate Oregon Health Plan data on SUD diagnoses as well as treatment, and this is broken down at the county level. The current plan that we submitted has the 2018 and 19 data. We will have the 2020 data in January and have some ways to consolidate some of the data so we have less suppressed cells in the data. This will really support additional estimates for the number of people with diagnosed and treated SUDs in the general population. Wanting to first acknowledge that we recognize the Medicaid population does not represent the state at large, and we've accounted for that in our calculations, or we will be accounting for that in our calculations. Also want to call out that the CAS tool will likely provide us an overestimate of what is happening in Oregon, while the survey data and the Oregon Health Plan data will likely provide us with underestimates of the data. We're going to be approaching this from multiple sides so that we can then zero in on what's actually happening with all of these different tools and methods in place. So I want to just dig in a little bit more about the inventory piece. This is the most time-consuming aspect that the graduate students will really be digging into to learn about what resources are available and a lot of information from each of these resources. So from the basic information side, they'll be learning about where the locations are physically located, what kind of services are available. But in addition, we will also have the graduate student workers asking more about the number of staff, demographics of both staff and leadership, a little bit about how things have changed due to Measure 110 or COVID, information about the burn affiliations, and then more specifically about services available. And then also we will have questions that involve access and equity, how services are accessed, what kind of specific services are available for LGBTQ+ people with disabilities, what kind of staff training is there around culturally relevant and trauma-informed care, language services, really trying to be inclusive of disability status, gender, race, ethnicity, and cultural resources, and understand what is happening there. Again, this both supports the gap analysis, looking at where we are under-resourced or not providing equitable care, as well as a searchable database so people can see where there might be care that they are interested in obtaining. So as far as what's next, like I mentioned, the final inventory and gap analysis will be complete at the end of June. We have some benchmarks that we are planning to meet in the process and we'll be sharing back with you all about. In January, we hope to have the updated Medicaid data, which will include the 2020 data and treatment data. We're also looking into where methamphetamine falls within the Medicaid data and might bundle some of these categories together to deal with some of the data suppression. In February, we plan to have the initial CAST analysis completed to share. March, looking more at the projections we have based on the survey and Medicaid data, as well as sharing the process and how we went about doing that. And then April, really presenting a draft of the full plan so that we can then spend the final 2 months wrapping it all up and making it into a final product. So this project is truly like putting together a puzzle. So at this point, we have some time saved to talk with you all about what else you'd like to see, what are we missing in prevention, in treatment, and recovery. I will stop sharing my screen so I can better see faces in the chat, but I'm happy to re-present if we need to look at anything again.
Mr. Chairman.
Yeah, Don, go ahead, hop right in.
Yes, Katie, Don Mazziotti, Commissioner. I'm very interested in whether you took a look at bringing the data to the city and census tract level. I know that's a major step, but did you look at it?
So we do have some like city level data. right now, as far as the national data, getting some of that even at the state level can be challenging, and then we can get it down to the sub-state for some of the data. So getting that level of data down to like the city would be something that we'd have to look more into, but I haven't seen yet. And again, like I mentioned with the fast timeline, that might be a great idea for a future next step or something we can think about long term as well. How do we get more granular so we can really understand what is happening in these more local sites?
Dawn, that's a really great question. I wanted to just kind of chime in. We will have address information for all of these resources. So it is not within our scope now. We are already running fast to do everything that's in our current scope. Right. But it would be pretty straightforward to do like a geographic analysis once we have our addresses. Most of the data that are included in the CAST methodology are obtained from census data. So that can also be broken down by census tract. So I love that idea.
I was thinking, Liz, that the population center might be interested in participating in some way.
That's a great idea. Thank you.
Yeah, thanks.
Okay, thanks, Dawn.
Thank you.
Tony Biglin, you have your hand raised. Go ahead.
I do. I think this is an excellent plan. It is an ambitious one to get it done by June. I can understand that. I have a few suggestions relevant to prevention, and I can just send those to you. Some things about adding some risk factors that I think are important. And I see that you're going to use the Oregon Healthy Teens Survey, which I'm glad to see. But I think there's one actually piece of data you can get on that, and that is to what extent is it actually being used in counties? Because there's a considerable gap in its use, and that very fact would be relevant to supporting, making sure that it's done everywhere. So I'll send you some things, but nice work.
Thank you so much.
Thank you so much, Tony. Do other commissioners have any questions, recommendations? Would like to participate? Okay, so I have a question. Okay, so running in tandem with this is an inventory, kind of how the money's spent. It was part of last legislative session's budget note, I believe, by Representative Tana Sanchez. Is there any linkage in that? Does there need to be any linkage in that for any reason? Would it be advantageous for us to link those two things? Dr. Richardson shaking his head no.
Yeah, I'll let Katie and Dr. Waddell respond, but we those of us who are on this group monitoring this contract strongly felt that we didn't want to encumber this inventory study with these other pieces because they were in process, and we are really comfortable with the methodology that they're using. And so I think OHA will be negotiating with OHSU about doing something relative to that study, but I don't think it should be a part of this particular one. But I'll let, please, Liz and Katie, go ahead and respond. Thanks, Tony.
Yeah, no
I'll
worries.
take it, Katie. I knew someone was going to ask about that one, so thank you, Tony. I mean, there is so much happening right now and so many cooks, and then you add Measure 110 and there are even more cooks. I am attending the Measure 110 evaluation stakeholders group, which has been a great opportunity to find out a little bit about what else is going on. Katie and I are working with Julia Dilley separately to try and get a handle on who's doing what, when, where, and how. And then I'm also in touch all the time with Morgan Godvin, who can keep me, as up to date as possible on the Measure 110 Oversight Council. That said, it is just really, really, really hard. to connect all of the dots. I do think it's critical, though, as we disseminate information. Hi, Morgan. As we disseminate information, that we do it in a way where we're sharing our findings with everyone who is engaged in this work. And I think that's a way that the commission, in addition to letting us pilot our tools on you before we take them live, will be able to help. So that's a long way of saying no, they're not connected.
Yeah, you know, I mean, correct me if I'm wrong, but I'm just thinking down the road, if we know what we have, we know where we're spending money, and we link those two things, and we understand the epidemiology of what's happening and what services do what, eventually we can come up with a number relative to what services we need to move the system forward to seek the two outcomes that the ADPC plan really is driving towards, which is increasing recovery, decreasing addiction rates.
A bonus working with Center for Health Systems Effectiveness, and I have John Fitzgerald's blessing to do this, is they ran all of the numbers for his Senate Bill 1040. No, it's not 1040. Yes, 1040. So the big report that John did on behavioral health, substance use disorder spending statewide. So we have all of that code. We have all of the brain trust who put together that analysis on our team. So at some time in the future, you know, I think that there is potential and infrastructure to bring it together, just not before June 30th.
Okay, thank you. Heather, thanks for joining us. You can go ahead and feel free to chime in. And then I think we got Mike, and Mike, I'll allow you to chime in as well. Heather, you're muted.
I think Mike's hand was up first.
He's waving to you. He's deferring to the expert.
Oh, thank you, Mike. Hi, Liz. Nice to see you. And two, I know you guys have a tight timeline, so I'm always happy to offer to support. And I know I can remember if we ended up scheduling or not, but there is the Oregon Health Authority provider directory being run by Lines for Life. And so we're working on that project with them. And then we have a lot of other data internally at OCBH, along with doing a lot, being part of John's whole thing that you mentioned. So we're happy to help lift that in any way, because it may be hard for your, well, to facilitate your graduate students being successful, because people are really in a rough spot right now. And so we could probably fill in a lot of data for you without even having to go out and talk to people, because they've already answered those questions in some other places. So we're happy to help in any way to help with.
Thank you so much. And I think we have either scheduled a meeting on the books, or we're in the process of getting that on the books. So absolutely depending on you.
Yeah.
We have the treatment directory that exists, the one that just
came out. SUD one. Yeah, that's been around
we have that one.
Years,
There's no prevention and recovery in there. Is that separate than what you're working on with Lines for Life?
All of the different potential places that we have some data are a little bit different. So I'll be happy to run through. That's been the problem. So we're really excited about your project, because in data is stored in different weird hodgepodgey lists, because they're, as Tony mentioned, come through different funding streams. And so they traditionally have been collected through the funding stream or the oversight entity. And so then none of the lists really match up. And so making consolidated places to look for things that programmatically is run together, they aren't data stored together. So it becomes really difficult for people who are not on the ground providing services to know what's actually happening, whereas people in the community know what's happening in their community because they're networking. But that networking has no way to be demonstrated at higher levels for evaluation.
Absolutely. And while we're on that, I see Mike is here. I'm really glad you're here. We have dozens of lists from various sources of recovery resources of all kinds. And we are going deep, right? Like, we're including housing, we're including job support, recovery gym.
I remember everybody does all those things.
Yeah. I'm hoping that Oregon Recovers can help us with those lists, and hoping that you have some lists, mailing lists, that, or any other sort of list that you might be able to share. Once we get our recovery list going. If you, Mike, or any of your staff could take a look, I think that would be incredibly helpful, especially if there's big gaps.
Yeah, it's, nobody, sadly, because the system's fractured and incomplete, nobody has the comprehensive list, right? And so we do have both a good email list that we've built over the last 5 years. We also have a good social media following. And then we have the Oregon Recovery Network, which is sort of crowdsourced. And so it's fractured and incomplete, but it may actually have small things that we mostly don't know about that are someone posted on there. And we can utilize it. I put the question in the chat, so I'll say it here. Do you have anyone in recovery on your team?
I can't disclose specifics, but yeah.
Okay, good.
Yeah.
Nothing about us without us, and the language and knowing how to navigate some of this stuff is hugely important. So if you have somebody that feels comfortable doing it, and that's really it's bottom line is comfort and cutting through bullshit. So I'm really glad. Yes, we're here to help in any way. I also put in the chat, we have a planning grant from OHA from another pot of money to look at, with Age Plus, to look at the gaps relative to seniors in the system, which no one's spent much time on. And so I don't know how comprehensive our work will be, but it has to be done, I think, by February. So once we have something like that, or even if we're going to do some focus groups, we'll let you guys know. And if you want to participate, observe them, that might be really helpful too.
Thank you.
Yeah, cool. Thanks, Mike. And then Heather, and then I'll ask anybody else if they have anything. Then I have a quick question, and we can move on if everybody's okay. Sure. You got to unmute yourself, though.
I'm sorry. I've been in meetings back to back for the last 2 days. I'm so tired. I'm so tired. I apologize. I was wondering if you could explain a couple, what your strategies are on the commercial side. If you have any unique strategies, I would benefit from hearing from them on the commercial, collecting data on the commercial side of delivery.
That is in process. Katie,
okay.
Do you have any bright ideas?
That's fair.
So important and so complicated. We were going to check in with Dr. Anderson. I don't know if he was able to join today, but that is a big part.
Yeah, and the CAST tool offers some recommendations around that, but it's definitely something that still we're developing. Yes.
And then I just have a question for you guys in the interest of time. Are you open to one-on-one sessions with subject matter experts to kind of work through some of the definitions? For me, I'm most concerned with the definitions of harm reduction and how that's being quantified and conceptualized. And I know we have Morgan here. I think would be a great resource for that. And then also just recovery. How is that being defined and how are we capturing it and what is that?
I'm really glad you brought that up. So our starting place for that are the definitions that we used in the ADPC strategic plan, which those of you who are on the commission, we went around and around and around and around and around, especially on harm reduction. Since this is an OHA ADPC effort, we are going to try as best we can to stay consistent with definitions that have been vetted. Jude Leahy is going to be a really important resource within OHA for harm reduction, for language as well as available resources. Recovery, yes, I think that's going to be one of those terms that we need to very carefully vet. The starting place is what we put in the strategic plan. So we are fully aware of the challenges there and are treading very lightly.
Okay.
Thank you.
And if people are interested in following up with you, how might they do that? Just email you directly?
They could, it is easier for us and more likely for us not to lose track of the questions. If they sent questions to Tori, we meet with Tori and Dr. Richardson at least every other week. So then we could be sure to address the questions in a way that we can get kind of FAQs and formal responses back to everyone. So it's not a bunch of one-off emails.
That sounds good.
And we will, come and be with you all, as much as you'll have us, maybe every other meeting or something between now and then. So definitely available through Tori. Sorry, Tori. And then we can come and talk in person.
Okay, thank you so much. Go ahead, Dr. Richardson.
Tori, just if you would put your email address in the chat just to make sure everybody has it, who might want to follow up with questions or comments.
Will do.
Thank you. Thanks, Chair.
Okay, yeah, no. Thank you guys so much. Very exciting. I've been asking for this for 9 years from the state. So, it looks like we're gonna get it figured out. And thanks Nicole and your team for helping out, of course. I'm sure you guys are busy. If there's no other questions, we'll move on to our next agenda item with Judge Block and Kat.
I'm not sure which one of you would like to go first.
Well, let me just set a comment or two, and then I was thinking it might make sense for Kat to go first, because I think the expungement piece is sort of the first line of offense in terms of helping folks in ways that we'll describe, and then 819 is sort of the backstop potentially. So just to sort of revisit this question of why are we talking about criminal justice in the Alcohol and Drug Policy Commission. Again, we all look forward to a future where the criminal justice system is devoid of people who suffer from substance use disorder and co-occurring disorders. Unfortunately, and despite a good first step to try and get folks who are only possessing drugs out of the system and out of the criminal system and into hopefully the therapeutic system of treatment and recovery in the community, we're still going to have folks with suffering with drug and alcohol addiction and associated mental health issues in our system, because they can and do commit crimes that are not going to be decriminalized now or really ever. And so again, we have the vision of, for those folks, making the system as therapeutic as possible while they're in the system, with an eye towards getting them out. And once they're out, being generous and restorative and supportive so that they can move on to have meaningful and fulfilled and contributing lives. And so the second piece of that is where we're able to now describe a couple of new law changes that I think will help sort of put even more distance between folks who have been in the system, who have paid their dues, so to speak, but yet there are lingering effects of their time in the system that many would argue are ungenerous, undeserving, and frankly, holding back those individuals from contributing to our community. So actually, if we could put up Kat slides first.
The 397.
It's here. I'm just keep fat fingering it.
And just like I 100% agree with Judge Block on this, especially when working with my treatment court clients after they've graduated, after they've stabilized. They are frequently looking at, okay, now how can I get these felonies off my record? Because they're in treatment court not for possession anymore, because that's been decriminalized, but for burglaries that they committed while they were in their addiction, or identity thefts that they committed while they were in their addiction. And so, you know, the big thing is, how can I get this off my record? How long do I have to wait to get this off my record? So that's what Senate Bill 397 was. It makes it a lot easier in a lot of respects, and also in most respects, aside from C felonies, it actually makes the timeframes shorter. I'm also going to preface this with Judge Block, please interrupt me if I'm getting something wrong. You will see, since you see a lot more of these than I do, even if you don't see very many of them. Next slide, please. And I apologize for my phone ringing. Next slide, please. There we go. So the first thing that I noticed when I was reading through the statute is they've changed a lot of language to make it a lot less technical and a lot more holistic. So defendant has been changed to essentially person, crime to offense, and applicant also to person, so that it is a lot more about who we are dealing with and not just the very hands-off language that it had previously been.
And less objectifying and stigmatizing.
Yes, exactly. Next slide, please. So things that can be expunged, any B felony except for person crimes or a crime involving furnishing a firearm to commit a crime, any C felony, any misdemeanors, any violations. They have added findings of contempt, which had not previously been in the statute because it was not technically criminal. And record of arrest or citation has always been able to be expunged. But again, it's continued in the new statute. Next slide, please. So things that can't be expunged. Generally, the Measure 11 type crimes that we think about: criminal mistreatment, sex crimes, any sort of criminally negligent homicide, endangering the welfare of a minor constituting child abuse, assault 3, and then I didn't put it on this list, but traffic crimes, so like Deweys and things like that, cannot be expunged. Next slide, please. So the timelines are one of the big things that have changed. Previously, you had to wait 3 years from the time you completed your sentence, and then there was a 10-year look back to determine whether or not you were eligible for an expungement. So if in 2015 you had a disorderly conduct or something, and then in 2020 you had another disorderly conduct and you wanted to get them both expunged, you would have to wait till 2023 for the 3-year time period for that disorderly conduct, but then there'd be that 10-year look back to 2013, and since you had that conviction in 2015, you'd actually have to wait till 2025 to get that expungement dealt with. So those timelines have, for the most part, been shortened. For a B felony, it previously was the B felonies that we chatted about before were previously 20 years, and that's now down to 7. C felonies unfortunately got bumped up from 3 to 5 years. And then the misdemeanor stayed the same at 3 years, so they kind of made a stair step, which ultimately wound up making the C felony increase a little bit. Lower level misdemeanors are now after 1 year, you can get them expunged. Arrest and citation goes from 1 year to 60 days. If someone is acquitted or the case against them is otherwise dismissed, instead of waiting 1 year to get that off their record, it is immediately expungible. If somebody gets revoked off of their probation, it used to be a 10-year wait time, and now it's only 3. And then that 10-year look back is now the same as the other timelines. So if you're trying to expunge a C felony, instead of having a 10-year look back, it's a 5-year look back. So that makes it, again, a lot quicker for people who have, multiple, sequential items on their criminal history. You still have to work from the newest back to the oldest. That's always been the way that it has been, but this makes it a lot quicker for a lot of people. The other downside to the 10-year look back that a lot of people were running into is that if they had an assault 4 and a disorderly conduct in the same and they were convicted of both, even if they were convicted of both at the same time, that is considered 2 convictions, and they'd have to wait 10 years instead of 3. Now, because the timelines are the same as the look-back timelines are the same as the expungement timelines, it's that 3 years, or it would be 3 years for the assault 4 and then 1 year for the disorderly conduct. So you might actually be able to get that disorderly conduct expunged earlier than the assault 3 or the assault 4. I'll get to the questions in the chat in just a minute. In terms of filing fees, they have, let me just make sure that So another big part that makes expungement a lot more accessible now is the fees have been reduced and the requirements have been reduced. There is now no longer a filing fee. It went from $281 to 0. So that is huge for a lot of people seeking expungement. You also don't have to go get your own fingerprint card done anymore. And now, so there used to be a flat $80 criminal records check for the expungement to, again, check that look back. And if you had, you know, a case in Douglas and a case in Lane and a case in Coos and what have you, you'd have to pay $80 for each one. Now it's the actual cost of the criminal records check, and you only have to pay it once because it's the state running information. They don't need to. They only need to run it once, even if there are multiple filings. Next slide, please. So in terms of hearing, the hearing used to be compulsory. If somebody filed for expungement, there would be a hearing. Now there's only going to be a hearing if the state objects to the expungement, and the state has 120 days to enter that objection. Otherwise, it'll just go through. As always, the court can take evidence. The victim of the crime can make a statement regarding expungement. And this is another lowering of the hurdle. Instead of the individual applying for expungement needing to prove that setting aside is in the best interest of everyone, essentially. Now the state needs to disprove that it is not in the best interest of society to set this aside by clear and convincing evidence. So not more of a burden than just a regular civil, more likely than not preponderance, lower than beyond a reasonable doubt. Obviously, it's that middle ground, but it's a pretty high hurdle for the state to hit in order to disprove, or in order to essentially disprove that this expungement is in the interest of public safety and all the things that the court would be looking at. And if there's a denial, there must be written findings. Previously, the state was able to use and the court was able to consider general behavior since the date of conviction. So like things that weren't necessarily criminal, but aren't necessarily pro-social either. But now it's very clear that the court can only consider criminal behavior, specific regulatory, administrative law or rule violations and things that are enforceable by civil penalty that specifically create a risk to public safety. So it's a lot more concrete. There's a lot less squishy wiggle room to just be like, well, I don't like how this defendant's been living his life. So it very much lowers the hurdles for people to get these things off their records once they've cleaned up their lives. Next slide, please. So when a conviction is expunged, legally the person is deemed to not have been convicted, and then the court shall seal that record of conviction, including the arrest or citation or charging document. If we're expunging an arrest or citation or a case that's been dismissed, again, the person's been deemed to not have been convicted, arrested, cited, or charged, and those records again are going to be sealed. whether or not the arrest or citation resulted in a further criminal proceeding. And because the timelines for the arrest citation are now so short, there is availability for the state to file to unseal the arrest or charges in order to file it within the statute of limitations. Statute of limitations on a misdemeanor is 3 years, and on a felony, a low-level felony is 3. So since it's that 60-day turnover, often prosecutors have a lot of time to file something past that 60-day mark. So that's sort of a really quick run through of what the new expungement statute looks like. And I can take any questions, or we can slide over to Judge Block's presentation and we can take questions at the end.
Why don't we go ahead if there are any questions with what you presented, and then we'll go ahead to Judge Block. Are there any questions, comments? Okay. Thanks for doing that, Kat. We appreciate it. Let me tee you up, Judge.
Okay. And while we're doing that, let me just sort of by way of introduction and connecting it up to the work of the commission. You know, carrying a felony conviction has very significant real impacts in the lives of those who are so encumbered, and those impacts, you know, are relevant to you know, the issues that we're seeking to address in our strategic plan. I mean, the well-being of folks in long-term recovery, whether it means access to jobs, to housing, you know, avoiding the stigma of being a convicted felon, and how that can affect your mental and emotional state that could be a trigger for relapse. You know, I had somebody once remind me that she couldn't go on school trips with her daughter because she was a convicted felon. And her daughter really didn't understand why mommy was never on the trip like other mommies. So in terms of its impact on individuals who we're seeking to help in our plan, it's there, it's relevant. The other issue that's related, of course, but distinct is you know, the workforce issues that we're struggling with, you know, people in long-term recovery who want to participate as treatment providers, as recovery mentors, et cetera. With their felony convictions, they are delayed significantly in gaining employment, sometimes to the point of outright denial. Even if they're ultimately approved, you know, the agency has moved on to some other candidate. And so there are some real impacts. So, and I think what the legislature has done on shortening the times, and mostly what they've done to try and take some of the subjectivity and some of the barriers out of the expungement process is really helpful. But as you can probably tell, Kat's really good at keeping track of all these time frames, but they're really hard to figure out. And in any event, you know, from the perspective of someone who has done the work of recovery and found recovery, you know, they want to get on with their lives, and they want to build lives for themselves and their families. And, you know, waiting a year or 2 years or 5 years encumbered beyond their date where they've been restored by their own efforts to a functioning, contributing member of society, that's really difficult. So 819 adds to this, adds another tool in our toolbox. And you know, there's some comments from Mr. Repetto, and one of them, some of them I absolutely agree with. One that says, you know, all these folks, the DAs, they're all against this. So this was actually a bill that was put forward by the district attorney in Multnomah County. So I think there are other district attorneys out there who are very on board with this whole approach of tailoring the consequences back to something that's more workable in light of our current attitudes and understandings. So let's go ahead. First is the bill.
Judge Blunt, can I interrupt you just for a second?
Yeah, sure.
Just because I think what your point that you just made is actually really important.
Yeah,
So I'm actually the president of the Oregon District Attorneys Association as the district attorney of Marion County. And both of these statutes that you two are talking about today, I personally sat on the work groups that created these. Oregon District Attorneys Association supported both of them. The one that Kat talked about was a highly negotiated bill. And it was actually a really functional work group. I will tell you, in last session, it was one of the most functional work groups we had with regard to criminal justice. And I personally sat on that. I personally worked with that statute. And on the one you're about to talk about, 819, it was put forward by Mike Schmidt, the Multnomah County District Attorney, but the association overwhelmingly supported it. So I just want to make sure I'm really clear. Mr. Repetto's statements are not accurate. There's a lot of support from law enforcement to do exactly what you've described, to work within the system to help people move forward when it's appropriate and it's good for public safety.
Thanks, Paige. Well, you know, when I first raised this with the chair and with Dr. Richardson about bringing this to the commission's attention, I was intending, I proposed us joint co-presenting on this so you could correct me when I made a mistake. And then that didn't work out. But anyway, you've sort of cast yourself in that role anyway. So happy to have your input on this as we go. So again, here's just a picture of the bill. You don't have to read it. We're going to go into the details, but just so you get an overview. Next slide. All right, so we're going to start with section 1A. And if you click it again, Dr. Richardson. Okay, so a person sentenced for a felony other than aggravated murder, along with the district attorney's office from the sentencing county, may jointly petition for reconsideration of the conviction or sentence. So key elements here are, first, it's a very broad, it's a remedy of broad application. So we talked about, for example, what, you know, the crimes that were listed that were expungible. This statute applies to any sentence or conviction other than aggravated murder, which I believe is the most serious offense that one can commit in the state of Oregon. So it really has very broad application. Second concept that's embedded in there is the application is a joint application from the person who was sentenced and convicted of the felony and the district attorney's office. And there, of course, the fact that we have district attorneys who are on board with this, who have supported this, who have really sponsored this, demonstrates that this is not, you know, it's not going to be an infrequent time when the person who is seeking to have the felony redressed is going to find you know, support from the district attorney's office. If that was the case, there'd be no point for them to propose this and or support this. Next concept is basically the petition is gonna detail, so that the petition reflects the agreement between the person and the district attorney as to what they're seeking here. It could be dismissal of charges, it could be vacating the conviction, could be a plea to an alternate offense or resentencing on the original or new conviction. So really there's a lot of options here you could just outright go back and dismiss charges that hadn't been previously dismissed. A dismissal makes them go away. Vacating conviction. So once someone is convicted, that conviction exists. Vacating it means it goes away. It's the functional equivalent of expungement. Pleading to an alternative offense. So someone might have been convicted of a certain offense, and the agreement might be to have them instead plead to an alternative, presumably lesser, less serious, less consequential offense. And then it could be the same offense, but it could just be resentencing. So if someone is serving a lengthy prison sentence, they could be resentenced to serve a lesser sentence, and in some instances might result in their immediate release. Paige, any additions or deletions there while I have you in the seat?
Sure. No, I think all of that is legally accurate. I do want to point out what's important is that this does have to be a joint petition. So each DA's office is likely, I mean, we do have 36 of them across the state. And so this is not something that it might vary community to community, and each DA's office is likely to have a policy as to what kinds of cases they will be considering. I will add that this was based and modeled off of a statute that's been in effect for only about a year in Washington state. And of course, they made that statute effective during the pandemic. It was kind of hard to tell what the actual applicability of it would be since our courts were a little bit backed up. It was hard to base what was happening in Washington and therefore forecast what would happen in Oregon. So there is a model for this, and that's exactly what has happened in Washington, which is each independent county's district attorney's office has their own set of when they will consider these. So you're likely to see different policies in each DA's office. I suspect some of the considerations will be based upon the crime and what folks will even be willing to triage. And there will probably be, for many DA's office, a burden upon the offender to kind of bring forward the kind of paperwork and material we need to assess that correctly. As you all know, district attorneys across the state, our primary function is prosecuting crimes, not necessarily looking back at old convictions. And so what we saw this as was a tool to really rectify those kinds of scenarios that might be concerning. Maybe the sentence was too harsh, especially with a 2021 lens going forward, but not necessarily replacing expungement. So what Kat just talked about for a lot of offices is going to be the primary mechanism for redress. This is obviously something that would stand outside of the expunction process.
Yes. And one of the things that I was aware of is that this was a lot of the discussion around this came from either as was just said, the sentence looks harsh in light of the 2021 lens, or in light of our recognition of some of the racial disparities in sentencing that have existed historically, or just, DNA evidence or some technology that has cast maybe a pall on some individual case and what was done there. But what I was really motivated to try and really promote with this is folks who are in the system because they were suffering from substance use disorder and have done really, really well, have moved on, and yet continue to be really hamstrung in a very significant way by convictions. And, when you're talking about folks who are, on the street, using, and sometimes, methamphetamine turns folks, for example, into, these nonstop actors that can commit and rack up many, many crimes and many, many felonies in a remarkably short period of time. you know, the opportunity for expungement for those folks is years away, and yet, you know, they exist in a very pro-social, very you know, highly contributing status in our communities, and they could be and do so much more if they simply had that opportunity. So I really am wanting to see if we can get those folks and that population on the radar screen at our state's district attorney's offices, you know, and have the commission act in that regard. Paige, did you want to say something else?
No, I think I think you covered it. I think that's great.
Okay, all right, let's go on. So basically, the process is just turning to the court side. So the petition comes forward. The court shall hold a hearing. It's not mandatory. The judge can't say, gee, I don't really, you know, I remember that case and I'm not going to have a hearing, whatnot. It's mandatory. The court, once the court has the hearing, it's not mandatory to grant the petition. The court may grant the petition if the court determines that the original sentence no longer advances the interests of justice. That is a very broad standard. That gives the judge lots of discretion to take into account all sorts of issues, including the issues that, you know, that I'm talking about here. Next slide. This is probably more technical than we need to go into now. It just deals with the fact that the court is actually resentencing the defendant as if he or she had not previously been sentenced. So it's really just resetting the entire process. Next slide. All right, so the court may consider post-conviction factors. So things like, so this is post-conviction. So this is everything that happened after the person was last in court being sentenced, which includes all the recovery work they've done. And it even references record of rehabilitation while incarcerated. So rehabilitation, by its definition, can include recovery work and while incarcerated, but if you can consider it while incarcerated, you certainly can consider what's happened in the community. Second bullet, evidence of whether a person's age, time served, and diminished physical or mental condition have reduced the risk for future violence. You know, diminished physical or mental condition seems like they're too old or something else is going on. But I would argue if you can consider diminished circumstances or conditions, you can certainly take into account changed physical or mental condition. And when someone becomes, you know, finds recovery and gets well from the disease of substance use disorder, their physical and mental condition is certainly changed for the better. Next slide. Well, okay, the amount of original sentence already served. Actually, evidence of changed circumstances since the original sentencing that shows continued incarceration no longer advances the interest of justice. That really speaks to if somebody is in custody and is still serving the sentence. Changed circumstances. So if someone goes into prison and does AIP, does a program and does really well and finds recovery, they're eligible for earlier release, but technically this could allow for them to be released even sooner than that by the court acting to amend the sentence with the agreement of the individual and the district attorney's office. Next slide. This slide just recognizes that the district attorney is obliged to make reasonable efforts to let the victims know of the process and what's going on and to give them an opportunity to participate. And the court is obliged to also give the victim an opportunity to participate. Next slide. Okay, so that's the presentation on 819, and we Paige, did you want to say anything in conclusion?
I would just add, I think that we had a lot of discussion about this as an association when it was coming up. I think DAs saw it as a tool to potentially handle those cases that really we didn't have a mechanism to get back into court with before. So barring an appeal and a reversal or some sort of PCR, district attorneys did not have the authority to take an old case and put it back into court. What this allows for is just that. And I would add that one of our biggest concerns were victims and victim cases. So you can imagine that many policies will be written around the fact that victims have input. They of course have constitutional rights at these hearings to be heard. And so I would suspect that many policies will revolve around the fact that that person crimes will probably not be included in your average case that would be brought forward. Things that affect real public safety and the victimization of people. But you can see potentially, as Judge Block pointed out, that maybe this can be used for the other kinds of crimes where we see really drastic attendant consequences to convictions that are maybe unintended, and as you pointed out, maybe getting in the way of people moving on.
And I just want to add really quickly that there's been a lot of bills this last session aiming on helping people get better that ODAA sponsored, and I appreciate that. These two bills, Senate Bill 218, which I was on the work group for, which is expanding conditional discharge to anybody who has been accepted into a treatment court charged with a C felony or a misdemeanor. So there's a lot of...
Perfect, Pat, you're exactly right. That was one that was actually presented by ODAA because we saw a disparate treatment. If you had a drug conviction, you could get a diversion or a deferred type of sentencing and a conditional discharge. But if you had like a UUV, you couldn't. And it didn't make sense to us that we could put you in treatment court for that kind of crime, but you didn't get the same benefit as somebody charged with a drug offense. So that came from district attorneys trying to equalize that.
Even though, like, at least in my treatment court, almost everybody in my treatment court is in there for vehicle possessions, burglaries, stuff like that. And in terms of what Judge Block was saying earlier about people racking up criminal history, one of my clients went from having 0 criminal history to being what we call maxed out repo. So repeat property offenses, the amount of prison that you're looking at escalates by 2 months with each prior conviction. And so she went from 0 criminal history to maxed out repo 30, which would be a 30-month sentence on her highest sentence in 3 months. She just went on a bender and burglarized a whole lot of houses and wound up getting a downward departure, getting through our RSAT and drug court program and doing really well afterwards. So, it is possible. But the unfortunate thing is the system at this point is in favor of having the hammer come down on these people rather than treating them. And so these new statutes are all ways to lessen that blow and help people move forward after that.
And thank you guys so much. In the interest of time, considering we're reaching the end of the meeting agenda, can we pass it over to Dr. Richardson to give us some updates and then get some public comment? I really appreciate this meeting in its entirety. We've really hit a lot of really cool different things that affect people with substance use disorder. Go ahead, Dr. Richardson.
Thanks, Chair. Thanks, everyone, for this conversation. It's been really helpful. All of you have the PowerPoint's up on the website so that you'll have access to this as if you want to refer back to the provisions of the new laws. I'm going to abbreviate my report and start with there will not be a commission meeting in December. Merry Christmas, Happy New Year. That's our gift, is the time of no meeting for December. Subcommittee members will continue with their work throughout December, and we will see you back in January. I also want to tell you that we've got some changes to the configuration of the commission. Sheriff Pat Garrett, who has been a longstanding member, one of the longest standing members to the commission, term has expired, and he is going to no longer be able to serve in his capacity with us. He has been just a fine person with effective service, and he wasn't able to join us today. He had an emergency that he had to attend to. He's probably one of the longest serving members with Judge Block on our commission. He's in his own community. He's the chief law enforcement officer, an innovative guy, has just done a lot of good work in his community, a lot of good work for our commission. When commissioners are asked to do anything, he has typically been one of the first people to step up and to get it done. And so we will miss him. We appreciate his service. We will send him a little trinket of recognition for his service to the people of Oregon. Also, Dr. Anderson has resigned from the commission effective at the last meeting. We will be moving to have additional members join us. The Senate held hearings this week, the Rules Committee, and approved the appointment of 3 new commissioners. The first one is a person working in healthcare from Multnomah County. Mike Obiero is his last name. Eric Martin will also join us. And then Vanessa Nordyke will come on board. She's an attorney and a DOJ litigator and a counselor for the city of Salem. Also, Heather Jeffress has been nominated. She will stand before the, well, I don't know about stand before. She will be sent to the Rules Committee in their December meeting, and we're looking forward to Heather joining the commission after the Senate takes their vote. I'll stop there. Forgive me for going over. If we could just take just 2 more minutes of your time just to see if there's any more public comment. Here, I'll turn it back over to you.
Yeah, thanks so much. Again, really great meeting. I know we have some members from the public here. If anybody wants to chime in briefly about anything we covered today. Okay, if not, happy holidays to everybody. Appreciate you guys being here. Really, I just want to say it's a really good meeting today. I think we hit a lot of areas and we're moving, forward. And I think we're beginning to get all of the pieces we need to really actualize and operationalize our plan. So the work continues, and as we move through the cheesecloth of bureaucracy that is our government. So I feel like we're doing a good job, with the tools that we have. So appreciate everybody here. We will update you on January's meeting and the agenda. And as always, if you have any ideas, feel free to call me or Dr. Richardson or email us.
Hey, thanks, Tony.
Thanks, everybody. Take care. Dr. Biglin, don't forget, can you just stay on for me, please? Thank you.